As a doctor, you should always be learning and keeping yourself up to date with what's happening inside of the medical industry. In this video, you'll learn 5 different avenues to stay up to date while building upon your professional development. Team talks. The health industry is constantly changing, from new practice methods to new approaches to patient care and the use of therapy in the medical field. You could get useful information from anyone who practices with you. Your colleagues are just as tuned into the industry as you are and could have lots of new things to share with you. Be open to discussion, whether it's over coffee or during clinical meetings. Conferences and courses. Next time there's a local or national course offered, look into what you could get out of them. While you need to keep your eyes open for sponsored meetings that might be pushing a product or a medication, you could still get some useful info. The information you get might not be radically different from what you know, but always be sure to read between the lines. There could be major changes in your industry coming down the pike, and being able to predict them is valuable. E-learning methods. From midwife to nurse to general practitioner, there are courses catering to every role with the aim to make you better at your job. Try a nationally recognized and peer-reviewed source for information rather than the first for practice company that you come across. The right course could introduce you to a new methodology that could drastically change the care you offer to your patients. Reading. Find practitioners who you trust and who you want to learn from. Follow what your favorite researchers do and look out for books they put out, or if they're online. You can search through decades of archived material on just about every website. You'll also find out about new guidelines that are being discussed around the world in peer support networks and in clinical meetings. Skill building clinics. Even if you've got the knowledge to aid in a crisis, without practice you can lose those skills. Beyond your regular updates to hands-on training for CPR or mouth-to-mouth, there are lots of new skills to learn. Even minor surgery requirements have been changed in recent years, and although general practice doctors don't perform much minor surgery, it's important to practice the skills. Stay ahead. Even the most highly skilled general practice doctor can get a little bit tired over time as bad habits take over. If you pay attention to what's going on in your field, you can always be ahead of your colleagues and even offer value to them. What ways do you stay up to date with the health industry? We'd love to hear from you and talk ways to help your practice stay on the cutting edge. Come visit our site and get in touch if you're looking for work-life balance while growing your skills. And if you enjoyed this video, be sure to like, comment, and subscribe.